Pleasant day to all our avid TV viewers and fans. Welcome to another episode of the highest grossing television program of all time.
This is the talk show that you should not miss watching every weekends, and the talk show that is worth your time because we believe that health is wealth. I am Marzel Bobadilla.
And I am Harold Arsenas. We are your hosts and this is The Medical Practitioners. So sit back, relax, and stay tuned for this show is about to begin. Good day, partner. I hope you are comfortable in your seat right now. And also our TV viewers who are tuning in to our show for today. I hope everyone is having a great time.
Thank you for the sweet gesture, partner. Actually, I am really anticipating today's episode because we will be having some skilled doctors in the field of microbiology. In this episode, we will talk about helminths, the signs and symptoms, its causes to humans, and of course, its prevention and cure.
That's right, partner. Now, let me have this opportunity to introduce to all of you the four medical microbiologists as our resource speakers. Please welcome Drs. Lyra Amoroso, Bea Abigail Brocal, Omar Ampatuan, and last but not the least, Dr. Maria Aliana Buenavista. Good day, Doctor.
Morning. Good day.
Morning.
Morning.
So, for the initial talk, I would like to ask Dr. Amoroso to please discuss with us what the helminths are. Dr. Amoroso, you may now have the virtual stage.
Good day, viewers. So helminths are worm-like parasites that feed on a living host for sustenance and protection, which can cause the host to become ill. They have a long, flat or round bodies and are invertebrates. They are considered as large microparasites. Adult helminths can generally be seen with the naked eye.
Thank you for that information, Dr. Lyra, but I would just like to ask, do helminths come in a variety of sizes?
Yes, Mr. Arsenas. These worm-like parasites come in a variety of sizes, ranging from less than 1 millimeter to 1 meter in length. Helminths would also infect different types of animals, including humans.
So, Doc Omar, how can helminths specifically infect animals and humans?
Oh, that's a good question, Ms. Bobadilla. So the transmission is mainly through a fecal-oral route involving ingestions of parasite eggs due to the consumptions of drinking water with human and animal feces, and also consumptions of crops which have been fertilized using manure, poor personal hygiene are some ways that animals and humans will get infected.
Oh, so helminths are indeed really interesting. Now, let us give the floor to Dr. Brocal to explain to us what helminths can do to humans. Dr. Brocal, you may now have your talk.
So, good day, viewers. Soil-transmitted helminths impair the nutritional status of the people and they infect in multiple ways. The worms feed on host tissues, including blood, which leads to a loss of iron and protein. Hookworms, in addition, cause chronic intestinal blood loss that can result in anemia.
So we have a follow-up question for you, Doc. So can you give us some signs and symptoms of helminthiasis?
So there are different signs and symptoms of helminth infection, Mr. Arsenas. So people with light soil-transmitted helminth infections usually have no symptoms. However, heavy infections can cause a great range of health problems, including abdominal pain, diarrhea, blood and protein loss, rectal prolapses, and physical and cognitive growth retardation.
Thank you for that, Doc Brocal. At this juncture, we will now be hearing your prevention and helminth transmission and the cure for its infection from Dr. Buenavista. Doc, you may now have your virtual stage.
Thank you, Ms. Bobadilla. The global strategy in controlling helminth transmission is based on the following ways: regular anti-helminthic treatment, promoting health education to schools, colleges, and universities, teaching of proper sanitation and personal hygiene, other means of prevention with vaccines and remote sensory. On the other hand, in treating helminth infection, there are three notable drugs are commonly used. We have praziquantel, ivermectin, and benzimidazole, such as albendazole or mebendazole.
So, what do you think of the use of antibiotics in treating helminths, Doc? Do you think it is effective?
This is a challenging question, Ms. Bobadilla. Although antibiotics are probably being used in the treatment of bacterial and protozoan diseases in patients who also harbored helminths, the technique employed did not detect the reduction in the helminth infection. Only those three drugs I have mentioned earlier are effective in treating helminth infection.
Thank you for clarifying this to us, Doc Benedista. In conclusion, helminths are large parasitic worms. Some of them are intestinal worms that are soil-transmitted, infect the gastrointestinal tract. These are also the parasitic worms such as cystosomes residing in the blood vessels. Furthermore, preventing helminth infection can be based on periodical deworming to eliminate infecting worms, health education to prevent infection, and improve sanitation to reduce soil contamination in infected eggs. Lastly, safe and effective medicines are available in controlling infection.
So that's it for today, viewers. We hope that you have learned something new about helminths and the way we could prevent its transmission in the environment. I would like to thank our guests for sharing their knowledge with us today. So that's it. We are your hosts and see you again for the next episode of The Medical Practitioners. Thank you and have a nice day. Bye!
Bye!